take my story. Look at me. I mean, I was healthy and then now I'm not.
She's 20 years old. She lives in our area, and she says she's paying the price for ignoring the warnings from doctors and health experts.
The issue of younger people being hospitalized and younger people making up larger portions of all COVID-19 cases is not lost on doctors and elected leaders in our region.
KDHE is reporting the average age of COVID-19 cases is now 37.
The number of cases in teenagers, people in their 20s, and the people in their 30s are increasing rapidly.
This is a trend noticed nationwide. As you can see from this data provided by the CDC, the number of people under the age of 50 hospitalized has grown weekly since mid-June. As for the more recent weeks, the CDC notes some data is delayed and those counts can rise as that new data comes in.
A 20-year-old stuck in the hospital for weeks hopes her story will hit home with young people not taking this virus seriously. 41 Action News reporter Emma James has her warning.
That 20-year-old Kansas woman tells me she lived a healthy life, ate healthy and was active before testing positive for the virus. Now she's been here at KU Med for nearly 2 weeks and is getting ready for a life-changing surgery.
I mean, I never thought I'd be in this position to be 2 weeks away from turning 21, and I'm basically losing a lung.
Before coronavirus, CECILIA ERKER was living an active and healthy life. She says the classic symptoms came out of the blue in early July.
I woke up and I felt like I got hit by a bus. I was running 102-degree fever. I had a cough.
She ended up developing a secondary infection. It destroyed most of her right lung, and she's having surgery next week. She says the experience has been terrifying, but she hopes her story will hit home for those who don't take the virus seriously.
And it's very real. No one's invincible. No one's immune. It doesn't matter if you're young, old, healthy.
CECILIA is one of a growing number of cases in which young people across the country are getting sick with the virus. In Missouri and Kansas, those between the ages of 20 and 30 are showing the highest number of people with coronavirus. Dr. Dana Hawkinson with the University of Kansas Health System says gatherings are likely to blame.
If we can remember to wear our masks and gather in small groups, certainly less than 10 is much safer than larger groups, we can really start to decrease the spread of this disease.
CECILIA hopes others will think of her story when they consider going against that advice.
I went out to restaurants, hung out with friends, and now I'm paying the price for it. And I regret it. If I could take it back, I would.
In Kansas City, Emma James, 41 Action News.